Hi everyone. Today I'm going to discuss about pediatric resuscitation. Approximately 10% of the newly born infants need some assistance to establish respiration at birth, and only 1% of these neonates need advanced resuscitation measures. That is endotracheal intubation, chest compressions, and medication. So what is the aim of this resuscitation? To prevent neonatal death and long-term neurodevelopment injuries or diseases associated with perinatal asphyxia. And also to assist newly born infant to take satisfactory respiration within 1 minute of life, that is called first golden minute of age, and also to prevent neonatal morbidity. Let's see steps of neonatal resuscitations. So here are the steps TABC of resuscitation. So first T refer to temperature. First one, maintenance of temperature. Second one is established open airway. And B, TAB, initiate breathing. C is for circulation. So let's see how we are going to maintain the temperature. So first, as soon as the baby born, maintain the temperature, dry the baby quickly, remove wet linen, place the baby under radiant warmer. So like how we need to maintain the temperature, because the womb temperature of mother is different from the room temperature. So immediately as soon as the baby born, dry the baby quickly and maintain the temperature. Next is the establishing open airway. Position the infant, suction the mouth and nose if there are any secretions. Also in few cases, trachea also has to be done suction. And ET tube intubation if it is needed. Next is the initiating breathing. Tactile stimulation should be done to initiate respirations, and PPV, positive pressure ventilation, when it is necessary, using either ambu bag and mask or ET tube. The fourth one is the circulation, that is chest compressions and medication. So let's see how it has to be maintained, how the steps to be followed in the circulation, how compression should be given, how it should be maintained. So step by step, we will see steps of resuscitation. First, as I said, maintenance of temperature. It is very important to prevent hypothermia in newborn baby. As I said that mother womb temperature is different and room temperature after the birth is different. So the baby may experience hypothermia. So to prevent heat loss, the baby should be dried immediately and should be kept under the radiant warmer. Next is the establishing open airway. How we need to establish open airway? First one is the position. So here are the pictures you can see which is the correct method. So neck should be slightly extended. It should not be hyperextended or underextended. The infant should be positioned on the back with neck slightly extended to ensure open airway. A rolled towel or sheet also can be kept under the shoulder, elevating them for 3/4 to 1 inch of the mattress to maintain the correct position. Next is the suction. It is very important, suctioning. If the infant has copious secretions in the mouth, as soon as the infant is positioned, suctioning of the mouth and nose, it is to be done. It can be done with the mucus sucker or suctioning machine. While suctioning the mouth, the suction tube is inserted till 5 centimeter mark at baby sleep. Do suctioning for less than 20 seconds. If thick or particulate meconium is present in the amniotic fluid, the mouth and oropharynx, hypopharynx should be suctioned as soon as the head is delivered during the labor. After the delivery of the baby, the trachea should be intubated and such. Next is the initiating breathing. Tactile stimulation. So what is this tactile stimulation? If respiration is inadequate, tactile stimulation may be given by slapping and flicking the soles and feet, rubbing the infant back. These slaps or flicks should be given only once or twice. If the infant remain apneic or positive, pressure ventilation should be started. So if it is not working out with the tactile stimulation, next we have to go for positive pressure ventilation using ambu bag. So bag and mask ventilation is indicated if after tactile stimulation, the infant gasping and respiration is spontaneous, but heart rate is below 100 beats per minute. Then with the infant neck slightly extended, to ensure open airway, place the mask on baby's face and ensure that the mask form a tight seal around the chin, mouth and nose. Compress the ambu bag here, the compression. Compress the ambu bag gently, ensure that the chest should expand. Give one, press the ambu bag, compress the ambu bag and check for the chest expansion. With every ventilation. Ventilate at a rate of 40 to 60 beats per minute. 30 compression should be given and 2 breaths. Let's see if there is no ambu bag, the situation is in the home or in the marketplace or some other places. Mouth to mouth and nose breathing has to be given. Make a tight seal with your lips to enclose the both nose and mouth of the baby. The artificial breath should be given with a lesser force but a faster rate, around 30 breaths per minute. And next is the external cardiac massage. So when despite giving mouth to mouth breathing, the child remains blue or markedly pale and we are unable to feel his pulse, it means heart rate has become extremely weak or stopped beating. So in this situation, what we have to do, we must provide simultaneously both mouth to mouth breathing along with cardiac massage or chest compression. The child should be lying on the floor on a hard surface without any pillow. So for older children, I'm talking about. So for infant, I'll tell you how it should be done. The child should be lying on the floor on a hard surface. Kneel beside the child. Place the heel of one hand over the lower half of the child's sternum or breastbone. The breastbone lies in the middle of the chest and extends from the midpoint between the two collarbones at the base of the neck to pit of the stomach. So move yourself forward over the child's body so that the shoulder are directly over his breastbone. Always keep your arms straight and without bending at the elbows. Press down on the lower half of the breastbone till 2.5 centimeters. Repeat chest compressions at a rate of about 80 to 100 per minute. After every 5 chest compressions, stop and give him mouth to mouth breathe. So continue this cycle. Next, heart massage in the infant. So this is for the older children. Next, in the infant. So below 2 years, chest wall and ribs are very soft and cardiac massage can be performed with 2 fingers. Instead of heel of the hand, we have to use middle or index fingers for providing chest compression in the infant. The chest has to go 1 to 2 inches and avoid pressure which will cause injury or fractures to the lung, ribs and injury to the lung. The fingers used for the chest compression are placed over the middle of the breastbone. The chest compression are to be done faster rate of 100 to 120 compressions per minute. Continue CPR until the breathing and heartbeat are re-established. Next is response. Response to ventilation, how it can be seen. See, if there is any improvement in the baby's color from blue to pink, heart rate is improved, our respiration is improved, heart rate rises to 100, more than 100, then the CPR is successful. So if not, again you need to continue this cycle. Next, let's see circulation. Maintaining the circulation. How to give this chest compression? As I said that 2 fingers has to be used in the infant. Index fingers, index and middle finger or thumb you can use. Chest compression are used to temporarily increase the circulation and oxygen delivery. Chest compression must be accompanied by ventilation with 100% oxygen so that the blood being circulated during the chest compression and also get oxygenated. So here during this chest compression, pressure is applied 1 to 1.5 inches. About 90 chest compression should be given in a minute. One ventilation should be given after 3 chest compression. That means 1:3. After a period of 30 seconds of chest compression, heart rate should be checked. So this is how chest compression has to be given. Next, medication if required. So neonates who do not improve with the ventilation and chest compression, these children are neonate require medication like adrenaline, sodium bicarbonate, naloxone and dopamine. Adrenaline should be administered in a dose of 0.1 to 0.3 ml per kg body weight. Sodium bicarbonate, naloxone and dopamine should be given. Sodium bicarbonate is given in a dose of 2 ml per kg body weight and diluted 1:1 in distilled water. In case of peripheral shock indicated by cyanosis, absent pulse or capillary filling time of more than 3 seconds, if volume expanders are given like so ringer lactate also can be given or 0.9% of normal saline should be given. So this is about the resuscitation. So when to stop this resuscitation? Let's see when to stop this resuscitation. First, when there is a signs of circulation are restored. Or when the medical team has arrived, ambulance services has arrived, when we handed over to the medical services. Then who is operating or giving CPR? Operator is exhausted and cannot continue, then it should be stopped. And when the physician assumes the responsibility. So this is about the pediatric resuscitation and neonatal resuscitation. Hope you all understood. Thank you.